So I guess, the question is with these vaccination breakthroughs, how do we stay safe? So I wanted to go to Dr. Fahmi Farah. She's been with us before. She's an invasive cardiologist and director of Global Health Alliance Foundation. Doc, good to have you here. I appreciate you coming back on. Let's just jump right in here. And how great is your concern that Americans aren't getting vaccinated in the numbers they need to be?
A matter of great concern for us in the front line, just because, we've seen the impact it's capable of having over the course of the last 1 year, especially what we saw during last winter. The months of December, January, it was absolutely catastrophic across the United States. We lost thousands of lives. And we know that we should be in a better position because we now have this vaccine that has great efficacy in prevention. So the fact that so many people are foregoing taking the vaccine is of great concern to us.
It's interesting. We've had these conversations and with different listeners, and for the breakthrough vaccinations, I've read that the people who do get the infection, it stays in their nasal cavity for a very short period of time, as opposed to people who are unvaccinated. In other words, it's more difficult for the people who are vaccinated to spread it because they are infectious for a shorter period of time. Do we know why that is?
The vaccine itself is, I don't know the exact reason why it's staying shorter time, but we know that of the people who are, the breakthrough cases that you're bringing up, we have seen, many breakthrough cases. But one message people need to understand is that even if they are getting the breakthrough cases, the ones who are vaccinated are usually not the ones to get very sick. You're right, their transmission rate is also low. They're not transmitting the virus as much. Their viral load is lower. That's the key factor here, is that their viral load is lower. And also they're not getting as sick, and as a result, they're not needing to be hospitalized, and definitely not in the ICU setting. More than 90% of the cases who are now very sick with the Delta variant here in the United States who are in the hospital and in the ICU setting are those who are unvaccinated. So that's the key thing that we have to keep in mind, that the vaccination is helping despite the breakthrough cases that we're seeing.
Obviously, everything that comes with this. We were telling a story about in Orlando, the liquid oxygen that they use to on the water to make the water drinkable and safe. They now need to treat COVID patients, so they might have to restrict water use. I mean, there's weird, ramifications of this. But one of the things I read that gave me hope, and another reason why people should get vaccinated, is that the chances of getting long COVID, if you're vaccinated, are minuscule at best, much, much smaller than actually getting the disease itself. Talk about, if you can, explain to people a little bit about long COVID and some of the, we've heard about brain fog. And in fact, I saw something today. There's some new research out about this kind of chronic sort of early dementia that, some people may be getting. What are your experiences with long COVID in patients?
I've seen many patients who are part of...
Can I interrupt you? Let's explain what long COVID is first, please.
Yeah. COVID long hauler is what we're calling the term. It's those people who have been infected with COVID infection, and for the most part, they have recovered from the infection, but it's the effects of the virus, the inflammation that it has caused to the body that's lingering on for months to, more than a year in many cases. So it's long-term effect on the body, on all over the body, different organ systems that people are dealing with months afterwards.
So you're a cardiologist. I remember early on we were worried about, and I can't remember the name of the syndrome for young children. Is that still an issue?
It still is, yes. It was certainly an issue before the Delta variant came about, and I expect that to be an even bigger issue now because Delta variant is affecting children more than the other variants did. So we have yet to get some data on that realm. It's a multi-organ system inflammatory problem that we were seeing with children. And in fact, during some phases of the COVID here in the U.S., we've seen some of that in adults as well. And that's part of the reason why this long COVID, long hauler phenomenon has come about, is that it's the inflammation of the multiple organ system that we're seeing and this is happening like long past the infection itself. Even those who have been tested negative multiple times since getting the vaccine itself are still dealing with it. You've brought up a good point, brain fog. So I'm going to elaborate on that. The inflammation, just like in the lungs, the virus is attacking multiple parts. Heart is being one of them. Brain is one of them. We have seen strokes happening in even young folks because the virus, through the inflammatory process, is creating an environment in the body where the body's forming clots, blood clots. And when the blood clots are there, we are at risk of having strokes, many strokes. Inflammation in the brain area can also cause different problems. It's not just an matter of getting the virus and getting lung infection. It's the systemic effect it's having through the entire organ system, entire body, including the nervous system.
I think long haulers has been not served well in getting this message out to unvaccinated people. I think that if they could see people, 6, 7, my friend who got it in November of last year was a, professional athlete. And he got the vaccine in like April, he got Moderna, and he's just beginning now to get his wind back. I mean, he used to be able to run, 10 miles in an hour. Just really an amazing athlete. And then he couldn't walk up the stairs without stopping, right? And he's beginning, and got his fingers crossed that he's beginning to pull out of this. Do we know? Well, let me just say what I was about to say. I think it's a good thing to tell people that think that they, it's like I get sick or I don't get sick. Well, no, you can get sick, and then you can have long hauler. I've seen numbers as low as, as high as, 12, 13, 14% of the people who get COVID exhibit some form of long hauler, maybe not for as long or forever, but some sort of residue. I don't, again, I'm just looking at these numbers from a story I saw on Apple News. But don't you think that would be a good message to send people, is like, this is not just a hit or miss. There's a third part to it.
Oh, absolutely. I think that's where one of our focus should be, is to inform the people that it's not just ending up in the ICU or, dying. If you survive, even with minimal symptoms, the long-term effect it can have, it could be life-changing. To give you an example, I've seen several patients who are in their 20s, these are young folks who had no prior existing, pre-existing conditions. And some of them are on oxygen tanks. These are 20-year-olds now having to carry oxygen tank because they're on oxygen. How life-changing is that for a 20-year-old? And we don't know when they'll be able to get off of the oxygen. So that's how life-changing it can be for a person.
Do you mind if I throw a couple questions your way from listeners?
Sure.
All right, we're talking to Dr. Fahmi Farah, an invasive cardiologist and a director of Global Health Alliance Foundation. Nice enough to spend time with me today, and you guys, obviously. Let's go to Gary in Daly City. A good question, Gary. Somebody asked us yesterday. Go ahead and ask Dr. Farah, please.
Yeah, thank you, Doc, for what you're doing. Question. I'm due for my third vaccine shot, probably October, November. The flu shot, probably around that time, too. The distance between the two, you should get one over the other, because I know the pneumonia shot, you have to wait 30 days, 31 days before you separate the flu and the pneumonia shot. Any studies being done on the COVID shot? Thank you for what you do.
Thank you. That's appreciated. It's funny because I tell people, before we answer his question, Doc, is I got the flu and vaccine and pneumonia on the same day, and I was down for 4 days. This is in 2019. It floored me. So it is there. And they also told me about with shingles vaccine to separate it for 2 weeks from the COVID vaccine. What's the general rule of thumb for the COVID vaccine and flu and pneumonia in general, the distance between shots?
So far, we have not received any clear-cut guidelines from the CDC on the two. But I will say I do think that it would be a good idea to separate the two by at least 2 weeks, 2 to 3 weeks, just because, as you said, most people do get a little bit of a reaction when they get their flu shot. Typically lasts about 24 to 72 hours. And that's usually the same with the COVID vaccine as well. Some people had a little bit higher reaction after they got their second shot. Lasted for anywhere between 24 hours to 1 week. So for that reason, I would say between 2 to 3 week separation would be a good idea, just to avoid that inflammatory, like that reaction that you may get from both the vaccines. And you should be able to get both the vaccines. You do not have to choose between one or the other.
On the booster shots, a friend of mine is a science writer from Bloomberg, and she questions. Well, Fauci came out and said, "Look, if you get the booster, you could have antibodies 20 to 40 times higher." I thought that was incredible, because I remember reading, when you got the Moderna after being sick with COVID, your antibody levels were, some were 4 to 5 times higher. But does that warrant? Do you think that this warrants a booster right now? Are they worried about something they're not telling us about, or is this just in response to the variants, which obviously the science had to know were coming?
Yeah, I think it's a multitude of factors. Definitely the fact that we're having new variants is part of it, because, as the virus is mutating, it's becoming more sophisticated. I'm talking about the virus itself. So we too have to, be prepared. And the booster shot is meant to be prepared for those variants so that our bodies can attack those and be at its optimal immune health. On the other hand, we also know that from the initial 2 shots that we've received from the Pfizer and the Moderna vaccination, we knew that it was not going to be a long-term immunity, and the longitude, like how long the immunity would last was questionable at that time. We did not know that. Now we have a lot of data, and both the companies, the Moderna and Pfizer, they've done quite a bit of research along with CDC, and they're all in agreement that this is not a long-term immunity. For the most part, it's 8 months is what everybody's saying, that, we're good for 8 months, but it's questionable how much immunity we have left of that beyond the 8-month period. And in light of the new variants that have come about, including the Delta variant, and also in expectation of more variants that will be coming in the future, I think the booster is a great idea. So I am in agreement with the booster so that we can prepare ourselves. Interesting.
And it's 8 months after your second shot, right? That's what they're saying right now?
That's what they're saying.
Yeah. Obviously, as a physician, and obviously the research that you do, and looking at all this, I mean, I'm sure you've studied SARS and MERS and just the incredibly high mortality rate. Both of those. I mean, MERS was 30%. That was right up there, like with smallpox mortality. Wouldn't you say that in another good way to look at this, at least right now, is we got miracle science with mRNA. This is transmissible, but not as deadly. We guessing what, 0.5%, maybe something around there right now. We don't really know because of the asymptomatic cases. I mean, you could come out of this and say, you know what, we caught a break, and we should be happy, and we should be accepting the science, because the big part of the break we caught is because of science. I mean, when you look backwards to see the previous pandemics going, from 2018 through 1958 through swine, MERS, SARS. When you look at this, what surprise? I've asked this question of almost every infectious disease specialist and physician and epidemiologist. What is the thing that you come away with this? Most people say the transmissibility, but for you, is it the same for you? Is that the thing that surprised you the most about this virus?
It did. It certainly, in many aspects, behaves a little bit differently compared to some of the previous virus that we've seen. Typically, as time goes by, most viruses, they do mutate, and they usually mutate themselves out, meaning, through herd immunity or whatnot. Like the virus, they become less virulent, so to speak, less dangerous. This virus, though, is not behaving that way. It's getting more sophisticated. It's figuring out ways of, becoming more contagious. Delta variant is a very good example of that. So those aspects about this virus really did surprise me, along with many other, medical professionals and scientists. I will comment on one thing that you just said. We should be grateful for science, and we absolutely should be. Just think a year back in the midst of the pandemic, myself, I can give you my testament that, when we were in the front line, and we were seeing, it was basically a war zone in the hospital. It really didn't feel like a hospital anymore. It felt like Star Wars, like out in space somewhere. That's how unreal it was. That's how dramatic and bad the situation was. And we really felt helpless at that time because we didn't have a weapon like the vaccine, which is the best weapon we can have against this virus. And the fact that the scientific community was able to collaborate on a global level and come up with a vaccination to help the population is remarkable. It's absolutely amazing. So I'm extremely grateful to the scientific community, and I really hope that the public, everybody who's listening and beyond, would come on board with science and realize how life-saving it can be.
Let me throw one more call in here for you. And Doc, you're doing great. Thank you so much for your time. I really do appreciate it.